Cimikoski. He's from Utah Stem Cells and Joint Treatment. And I'm talking now to all you weekend warriors out there that have those achy joints that you put off doing something about them. Well, this is such an interesting option out there for people. It's not surgery.
It's not surgery, and a lot of people just don't know about it. A lot of people have seen orthopedists for various types of joint pain. It can be in your knees, shoulders, hips, back, necks. And for a lot of people, they've thought that surgery was the only option. In fact, orthopedists often tell their patients that you have such bad arthritis, bone-on-bone arthritis, it's really your only option. And several years ago, that really was the only option. But medical science has now learned how to use stem cells and platelets, we call that PRP, to inject into and around joint spaces to actually regrow cartilage and regenerate damaged tissue. That includes things like tendinitis, other types of ligamentous problems like laxity in the ligaments. But primarily as people age, arthritis ends up being probably the biggest problem that people have. And now there's a much better solution than surgery.
All right, talk us through what are stem cells and how do they heal the body?
Great, great. That is the most important concept to understand. And we're probably all hearing in the media about different applications of stem cells. It's really the greatest advancement in medical science over the last 10 to 20 years. And stem cells are the cells that are laying undifferentiated in your body, meaning that they're just waiting for the body to tell them where they should go and what they should repair. And so when you have an arthritic joint or a torn tendon, stem cells migrate to that area to try to heal it. The problem is, and these stem cells will become whatever tissue the body requires them to become. It'll become new cartilage, it'll become new tendons, new ligaments. The problem is that your body's just not sending enough stem cells to heal and keep up with the problem that's occurring, and also isn't sending enough platelets that have all the growth and healing factors. So how these treatments work is that we actually inject right into the joint spaces and around the joint stem cells and platelets, and we send in thousands of times more stem cells and platelets than what your body can send in on its own.
Wow. How long till you see results, and do you need another treatment?
So for many people, it's just one treatment. Sometimes you might need to follow it up with a platelet-rich plasma, just a PRP treatment. But primarily for many patients, it's just a one-time treatment. We send in enough of these cells to repair and regenerate the tissue. We used to get stem cells directly from the patient, and we can still do it that way, but there's a better way, even now in the last couple of years, that makes it even better, and that's using amniotic stem cells. So we can take stem cells that come from a live, healthy birth, from a donor pregnant mother. These are not coming from fetal tissue where embryonic stem cells come from. There's a lot of controversy with that because they're coming from aborted fetuses. But these are coming from a live, healthy birth that go on to have a delivery. And these stem cells are even more potent and pure than your own adult stem cell. And so that's why we're getting so much better results than we used to.
This is located in Sandy, but their website is utahstemcelltherapy.com. They're at the Intermountain Health and Wellness Center there too. So call for more information. Thank you so much.
Thank you, Misha.
Interesting
Appreciate
information.
being here.